counter-terrorism measures. And we see that same rhetoric emerging of human rights concerns somehow as a hindrance to appropriate measures to promote security and public safety. We see the diminution of due process and democratic oversight mechanisms in the name of emergency. And with that comes a corresponding increase in risk of misuse of measures or inadvertent discrimination or human rights harms as a result of measures that are heavy-handed, overly broad, vaguely defined, or rushed into operation. There's many ways to approach this issue and to analyze the topics that arise from it. And through the expertise and experience of this particular panel, we're going to approach it from several vantage points. The first and most directly substantive question is actually how these COVID-19 response measures are being developed, and with reference to what information and evidence base. Counterterrorism as a doctrine has many varying and competing claims to expertise, but the question of efficacy of many counterterrorism measures remains elusive or difficult to track, partly due to an official withholding of information and a challenge in accessing, proper data as to how and why certain measures are justified and deployed. So before we get into this discussion, I'd like to briefly introduce the three speakers we're going to have today. The first will be Martin Scheinin. Many of you will know Martin as the first UN Special Rapporteur on the promotion and protection of human rights and fundamental freedoms while countering terrorism, a post which he held from 2005 to 2011. Our second speaker will be Dr. Sehar Iqbal, Director of the Sajid Iqbal Foundation in Indian administered Jammu and Kashmir. And our third speaker will be Dr. Mutuma Ruteere. Apologies if if I pronounce your surname incorrectly. I'm sure you will correctly. And he's the Director of Human Rights and Policy Studies in Kenya. So I'd like to start with a question for you, Martin. And that is, what of the implementation and reception of COVID-19 measures demonstrated about the role of expert input in crafting responses to emergency situations? And how is that expertise qualified? And what lessons do we see emerging in this space? And perhaps you'd like to link that to your experience in the counterterrorism world.
Thank you for the question. First of all, I do acknowledge that COVID-19 constitutes a genuine emergency which threatens the life of the nation in many parts of the world. And one can say that with confidence simply by looking at the death toll, which is far worse than terrorism ever was. The latest global terrorism index says that in 2018 there were 16,000 deaths because of terrorism in the world. We have that number of deaths in the 2 worst days of COVID-19. And every day, over 2.5 months now, every single day has been worse than 9/11, if we simply count the loss of human lives. So yes, this is an emergency. But it also tells us that this emergency is far worse to be driven by the so-called counterterrorism experts and their methods, which haven't been always evidence-based and haven't been rational. For instance, in proving the security measures of the proposals made. So when we take lessons from the experience of counterterrorism, I think it's quite a lot about what not to do, how to avoid the mistakes that were done post 9/11 over the following 20 years in the fight against terrorism. And when I look back at counterterrorism, there was far too much listening to the so-called experts. Those who were specialists in counterterrorism were dictating not only what the security situation and the threats are, but also what is to be done. And easily they were pushing for a maximalist agenda. Everything has to be done, which is humanely possible and technologically possible. And then politicians easily bowed to that pressure and pursued also the approach of anything and everything has to be done, whatever is the cost, financial cost and human cost. And politicians even engaged in a kind of an auction, who's toughest on terrorism. Human rights people quickly realized that human rights are forgotten in this equation, and there needs to be a human rights response. But it took a while before that message took hold. We are somehow in the same situations. Virologists know a lot about viruses. Epidemiologists know a lot about epidemics. Public health experts know about public health and the capacity of the healthcare sector, but they do not necessarily know about human behavior, human conduct, and what influences human decision-making, how people make responsible and rational decisions. And there we need public information, and we need human rights lawyers. So we should not, as we shouldn't speak in the context of counterterrorism, we should not speak about balancing or proportionality without defining what we mean by proportionality. And here expertise is extremely important. That let's say we have a legitimate aim of fighting against terrorism or fighting against an epidemic, and let's have the facts. What is the threat, and what are the measures that would be most effective in combating the risk? And then we ask the human rights people to assess those measures from the perspective, which one of the proposed measures gives the best benefit in the sense that it reduces the harm done to human rights. So I am all for proportionality, but you have to get the apples and the oranges right. There must be evidence-based assessment of the proven benefit towards fighting the epidemic against the proven, equally proven human rights harm that results from it. And this proper process of proportionality will result in primacy for local, targeted, precise measures, which, for instance, are sensitive in respect to vulnerable groups, rather than nationwide, politically adopted, hastily decided mass measures, which in the worst case will be counterproductive, and in most cases will be ineffective. So instead of nationwide lockdowns, we should look at targeted local measures. And in many countries, we now speak about the so-called second wave. That wave is not necessarily a wave. It will start with local small clusters of contagion. And evidence-based decision-making will then look at those local hotspots and decide about targeted measures on the spot. So we can nip in the bud any possible second wave if we apply an evidence-based process of decision-making where the human rights impact is an important part of the equation. Measures need to be not only serving a legitimate aim, they must be necessary, meaning no other measure can reach the same benefit, and they need to be proportionate in respect of the human rights harm. So that's how I see the role of expertise. It must be multidisciplinary, and human rights must be part of the equation. Thank you.
Thank you so much, Martin. I'd actually now like to go to Mutuma and see if you can speak to the question of accountability and oversight re COVID-19 emergency measures in the context of Kenya. Does what we've heard reflect the way oversight is curtailed in respect of other national security measures? And to what extent are you concerned that these structures that are now being put in place to deal with the COVID response may become embedded in normal law or other legal processes, even after the current crisis and pandemic abates?
Well, thank you very much, Ben. And I think when you look at emergencies such as the kind we have with COVID-19, one of the things that happen when you have these kind of emergencies is that the security actors take the center front. There's a scaling back of justice the operations of justice institutions, such as the courts, means that the means by which people would have availed themselves of redress have now been scaled down because of these emergencies. Then you have curfews, which come with the restriction of movement. It means that you have less independent actors witnessing what is happening. You have less mobility of the media. as well as oversight institutions. And as we all know, when you have those kind of context, you're likely to have problems with regard to human rights that go unreported and documented, because all this is happening within this exceptional moment when you have scaled down the justice institutions, and when you've given more power to the police. I mean, that's what we have seen in Kenya. That's what we have seen in many other countries in this region, as well as in some other places in the world, where the police have enforced the health emergency regulations in a way that really has been, in some cases, disproportionate, in some cases, overstepping what would be expected even under the laid down emergency rules. And that portends a challenge, because there's also a fairly broad public support for these measures. The public in all these places, very similar to the situation with terrorism, the public is afraid of the disease, and therefore the public is often much more willing to support some rollback of protections. And as you have seen with counter-terrorism, when that happens, then there's a real danger that actually the protections of rights, particularly for those most vulnerable groups, increase. In Kenya, for instance, we've seen that with a lot of complaints with regard to individuals who are living in poorer neighborhoods in the cities, where some have been arrested because they were walking home late, and then they find themselves in the quarantine for 14 days. And many of them, these are poor people who really don't have even the resources to pay for those quarantine facilities. So the emergency, the health emergency has really opened the door for quite an expansive list of violations. And as I said, the danger is that when this kind of situation goes on for quite some time, then obviously governments develop the appetite to continue with such measures, because they are getting less trouble from human rights activists, from the media. So there's an interest in keeping these measures. So people working on human rights, people working on issues of accountability have to be very vigilant to see that these exceptional moments of emergencies don't continue beyond the health, this pandemic. So thank you.
Thank you, Mutuma. So I'd like to come to Sehar next. The issue about how accountability can be suspended as a result of emergency measures has been raised. This is an issue that aligns sort of COVID-19 responses with some of the responses to conflict or terrorism-related events. Unfortunately, where the conflict and security counterterrorism paradigm is already, particularly entrenched, the overlay of sort of further significant powers to regulate that community can take particularly nefarious forms, especially in a context where ordinary measures of accountability or oversight have already been suspended. Can you speak to the experience of Kashmir in this context and the way pre-existing Indian responses to the security situation there have intersected with COVID-19 measures since the start of the crisis? Thank you.
Thank you, Ben. We all know that Jammu and Kashmir is one of the most militarized areas in the world. And as of August last year, there has been a unilateral rollback of J&K's constitutional position by the Indian government. This has led to a systematic disabling of safeguards and institutions designed to protect the most vulnerable groups, the poor, women, children, and the differently abled. So we have the situation where legal statutory bodies that were set up by the state to protect these groups from discrimination and abuse have been dissolved by the Indian government. These include the Women's Commission, the Commission for Protection of Child Rights, and the State Accountability Commission, that was a statutory body to check corruption by government officials. So we have basically this legal vacuum that has arisen because of this highly centralized response, and because the state has already taken emergency powers that bring this Jammu and Kashmir directly under central rule. What COVID-19 has done on top of that is, because this centralized administration is there, there are additional restrictions on movement, additional restrictions on the flow of goods and services. So we have, on one hand, the legal vacuum, and on the other hand, a highly centralized administration with no accountability and no safeguards for the most vulnerable. This, in many cases, has led to large-scale corruption. For example, in the procurement and distribution of PPE and life-saving drugs, putting the lives of thousands of Kashmiris at risk. So just to sum up, what we're seeing in this highly militarized legal vacuum in the context of the COVID-19 pandemic as well is the disabling of democratic and legal institutions, no checks and balances on the power of the central government, and a worrying abandonment of due process, all of which put lives and rights at risk.
Thank you, Sehar. I'd like to come back now perhaps to Mutuma, and building on the scenario that Sehar has just described, heavily securitized context, you know, the frankly frightening way that the response to COVID-19 is playing out in Kashmir, something I think the whole human rights community should be taking very seriously. Can you speak to the way in which the security and policing paradigm has been adopted and expanded in Kenya to encompass, to the extent that it has, a full-scale militarized response, and whether even, you know, private actors may have been engaged in this process, you know, as they have here in the UK, where I'm speaking to you from? Thanks.
Well, thank you very much. Yes, what you see is not just the police involved in responding to the COVID-19 pandemic, but also the engagement of the military in, you know, typically what we call police support operations. And this is very similar. You can see parallels between this and counter-terrorism operations, where the military comes in to undertake police support operations. Well, as often happens when you have militaries in place and working side by side with the police, very often the militaries tend to dominate the process. And over time, there's a kind of difference to the military because they bring in superior skills and also resources that the police may not have. So you find increasingly policymakers deferring to the militaries. Now, the militaries also, is the narrative and the argument that goes, is less corrupt, and it gets things done that the way the police may not get things done. So they are, again, you are dealing with a broader policy as well as public support for increased use of militaries in dealing with these kind of emergencies, similar like what we have seen with counter-terrorism. The challenge, of course, is that militaries are much more opaque than police services. We know a bit on what to expect of the police. We have accountability systems. We have a better understanding on how to hold them to account and how to interact with them. In most cases, the systems of accountability for militaries are much more difficult to actually penetrate. And in some places, they are actually not there. So you find a situation where seeking accountability where there have been accusations of military officers involved either in the enforcement of curfews or in the broader enforcement of the regulations, emergency regulations, becomes much more difficult for citizens. Add to that the fact that the surveillance that we are seeing is using private technologies or private companies. And these are private companies that are not subject to the same kind of oversight and of accountability the same way as the police. So you have two actors with a lot of power, the private actors and the militaries where you have less accountability systems, unlike the case of police. And for me, that tends to portend some challenges moving forward in terms of how we ensure that we own accountable with these institutions, that the information flows as it ought to, and also to remind ourselves that this could become the norm, where these actors that are less subject to accountability gain more power and become more influential in running of other affairs, particularly if they prove that they can get job done within this context of COVID-19. Thank you.
Thank you, Mutuma. Perhaps I could come back to you now, Martin. Mutuma was mentioning the involvement of private actors, and certainly here in Europe we have a heavy reliance on private actors as well, including private phone companies, which, as we all know, are being positioned as important and instrumental actors in the fight against the spread of COVID-19, particularly through the established paradigm around contact tracing. Can you speak to the question of how data and privacy is intersecting with COVID-19 as a public health crisis, and how this sort of mirrors or differs from the way in which data and privacy has become a serious flashpoint in the context of counter-terrorism measures? Thank you.
Yes, I think there are similarities, but the main difference is that we are much wiser than we were after 9/11. After 9/11, human rights were forgotten, and there were atrocious human rights violations committed in the name of fighting against terrorism. And that resulted in the, I think, justified reaction by the human rights community to focus on serious human rights violations, such as arbitrary killings, torture, disappearances, arbitrary deprivation of liberty, secret detention, which were kind of defining the human rights and counterterrorism debate for a while, and a lot of other things went unnoticed. When I started as Special Rapporteur in 2005, I soon declared an intention to look at the full scope of human rights, how they are affected by counterterrorism measures, and for instance chose the impact on economic, social, cultural rights as a topic for one of my reports. And the same was privacy. I remember very well that it was only 2008 that I announced that my next report will deal with the privacy impact of counterterrorism measures. And some of my good NGO friends said, that's ridiculous, that's a trivial issue. Now we know it was not a trivial issue then, and it's not a trivial issue now. Privacy has really become a frontline issue in the counterterrorism context. And with COVID-19, we know it from the beginning, that there are the two important battles which are ongoing and ahead of us. One is about the so-called contact tracing apps, and one is about so-called immunity passports. And as I said before, we need the expertise. What's the proven benefit of these measures for fighting the epidemic? And what is the proven human rights impact of the ways these measures will be implemented? And I think in both cases, the outcome will be the same. We do not need mass surveillance. We do not need an apartheid society of the immune and the non-immune. We don't need an Orwellian structure of members of the party and others, exclusion. And what comes to contact tracing apps, I've tried to propose that they are not contact tracing apps. They are proximity alerts, which tell you over Bluetooth technology usually that you have been physically quite close to a person who has now been found to be infected by the virus. That can be a next door neighbor. That can be an occasional guest of a next door neighbor in an apartment building where there was no contact whatsoever, or it can be a passenger on the same bus. or everybody wearing masks, but still you were in sufficient physical proximity that there is a Bluetooth alert. So in order for those apps to function, they must be separated from the contact tracing. People must not be subjected to privacy intrusive contact tracing simply because they get a proximity alert. So that's taking the evidence first and asking the experts, what does this alert actually tell you? Same thing with the immunity passports. Very little is known about immunity in respect of COVID-19, but what we know is that the prevalence of the virus is surprisingly low. And that has the consequence that even a tiny error margin of false positives will completely distort the results of the serological tests in respect of individual cases. So the immunity passports would be totally useless when half of the people who got the immunity passports actually did not have the virus because they are false positives, thinking about the marginal error and the actual low prevalence of the virus. So once again, the evidence will speak for using representative serological testing of the population for epidemiological purposes, but absolutely refusing to attribute any rights or obligations on the basis of whether somebody tests positive or negative. There is one legitimate use of the individual result. It is after you are hired for work, for instance, as a healthcare institution. It matters for your individual wearing of personal protective equipment whether you have immunity or not. But that should be for the professional healthcare people and not for the employer to test. So it affects your choices, how you protect yourself and how you protect your clients. But that's after being recruited, and that's not a passport for recruitment or against it. Thank you.
Thank you, Martin. I'd like to come back to Sehar now. I think, you know, the trend that's emerging here is, in this conversation, is that in both the sort of the CT spaces and the COVID spaces, is that state access to data and intelligence, you know, the key theme is the lack of oversight of this use of data and the profound risk of abuse and even weaponization of these measures against marginalized groups, minorities, political dissidents, and other activists. You know, and we've even heard the language of track and trace, you know, which was designed in response to COVID being used in the context of tracking Black Lives Matter protesters. Counterterrorism contexts have sadly amply demonstrated how measures that are sort of prima facie neutral can be weaponized in really problematic ways that perpetuate massive human rights abuses. Sehar, perhaps you could speak to the way in which COVID-19 measures are being used against the population in Kashmir and specific issues that are arising in that respect. How has the emergency been used opportunistically, if it has, to institute problematic legal or policy developments based on your recent experience there? Thank you.
Thank you, Ben. As you know, even before COVID-19, after the abrogation of Jammu and Kashmir's constitutional powers, the Indian government made mass arrests in the following months. So estimates of how many people were arrested, which included lawyers, activists, trade union activists, political leaders, and student leaders, etc. Estimates vary between 7,000 and 12,000. And by the government's own admission, 450 of these political prisoners are still languishing in jails in Jammu and Kashmir and the rest of India in very overcrowded and unhygienic conditions. Now, there are women amongst these political prisoners, which include at least 2 pregnant women, one of whom has tested positive for COVID-19, but has been denied a safe space for quarantine. So one is these indiscriminate arrests have put political prisoners against whom there's very little in the way of legal evidence in jails where there's a lot of overcrowding, and it puts them at risk, at a very high risk of developing the infection. And the government has no plans of letting them go anytime soon. The second point I wanted to make is that Jammu and Kashmir is facing one of the highest infection rates in India. And, Kashmiri doctors and activists have been scrambling to get to vulnerable groups to provide treatment, access to food, healthcare, and medicines in time, because the government systems of delivery are not working very well. But the restrictions on movement have been used by the police and the armed forces that are sort of working in a support role to detain, harass, beat up and threaten doctors and activists. So we've had cases where even the chief medical officer of a district who is in charge of the COVID-19 response was detained and harassed by the police for even trying to get to work. We've had cases of doctors being beaten up when they were trying to reach hospital for emergency duties. We've had cases of activists who are trying to deliver food aid being detained and threatened with arrest. The third point is about the excessive use of military force against non-combatants and the high quote-unquote collateral damage. As we're seeing, even with the high military response that's coming from the Indian government, the incidents of militant violence have not really gone down in these months since August, but actually gone up. We are seeing a lot of gun battles in urban and rural areas, but the amount of force being used to disperse what are essentially a handful of militants is non-proportional, to say the very least. So we've seen in Nawakadal, which is in the summer capital of Srinagar, and Pinjura, which is a rural area, that entire rows of houses were burnt down, and military-grade shells were used, against to bring these structures down, where essentially they were like 4 or 5 militants at the maximum. The restrictions that were there on the movement prevented the aggrieved house owners from protesting with their supporters and the mainstream media from reaching the place on time. So people are being made more vulnerable, they're being made homeless due to this indiscriminate use of force that is non-proportional, at a time where the emphasis is on staying home and staying safe. These people are being made homeless and more prone to infection. And finally, the last point that you asked about, because of the media blackout, because of the restrictions that prevent people to come out and protest, the government is using this to introduce legally contentious changes to citizenship. So in the past month, they have introduced new rules that require residents of Jammu and Kashmir to obtain domicile certificates from the central government before seeking any government employment. A lot of legal experts are saying that this will pave the way for to invalidate citizenship certificates, the earlier held state subject certificates of Kashmiris. And in time for Israel-style settlements in Kashmir. The idea being that the demographic change that the Indian government wants to effect will help in diluting the Kashmir issue internationally. So we're seeing this very militarized response being enabled by even more legal provisions in the wake of COVID-19 to basically target people and vulnerable people in a variety of ways.
Thank you, Sehar. Thank you for sharing that. I'm now going to switch to some questions for the panel that have been appearing in the chat, which someone behind the scenes has been kindly feeding me through my phone. I'm also told that Martin has been answering questions in the chat in real time, going above and beyond his duties on this panel. So for those of you following, I'd urge you to have a look in the chat at Martin's responses. I want to perhaps start with Mutuma with a couple of questions. The first is, what should the enforcement of pandemic regulations look like if we agree that the use of force by security forces and detention of people not complying is inappropriate and counterproductive? So I guess that's a question about sort of alternative frames. And then secondly, I think, this is a question we're all struggling with and something many of the audience will be interested in, and I'm going to ask it to all panelists. How can civil society sort of monitor and push back COVID-19 measures that undermine rights? How can we respond to this trend that we're seeing both locally, nationally, and globally?
Thank you, Ben. I think there is really a need for law enforcement actors to listen more to health actors than before they carry out certain forms of enforcement. I mean, when you look at some of the measures that are taken where the people are flouting curfews are arrested and taken to police station, it defeats the whole purpose of these measures, which is basically to contain the spread of the disease. Because if you're going to put people in confined places without the requisite protections, without the social distancing, then it actually undermines the entire goal of the entire emergency regulation. So there's need to listen more and to find solutions and to work with health professionals on what would be the best way. And also the second point is, and I think this point is also made coming in at a very opportune time because of what is happening globally with Black Lives Matter, it is a discussion on the fact that not everything ought to be criminalized. Flouting of health regulations, when we have to bring in the police and you put people into the criminal justice pipeline, always one, defeats the purpose. And second, it creates more problems and criminalizes individuals when it ought not to. Yes, there are other ways in which you can sanction individuals. And one of the best ways is actually systems where you work with communities themselves, because already this is something the communities themselves accept. Everyone accepts that there is need for certain forms of enforcement. And working with the people so they actually work with the law enforcers rather than criminalizing individuals, in my view, has a more potential of actually controlling the pandemic. The answer to your second question with civil society, again, this is where I think technology is very useful. And again, I can draw the example from the Black Lives movement and also what is happening with policing globally. If we did not have cell phones that can take pictures, a lot of things would never have been reported. It is not that they were not happening, they were happening, but they are being reported now and captured live on social media, reported on social media, and reported on phone. So the presence of civil society actors and work with communities at local levels to capture this, what is happening on the ground, even though they cannot be there. To work with communities, they can record them and transmit this information. It provides for the opportunity to actually put pressure on government officials, on law enforcement officers, so that there is a more rights respecting approach to the policing of this pandemic. Thank you.
Thank you, Mutuma. I felt like the entire panel and everybody who's joined us smile when you said not everything needs to be criminalized. I'd now like to go back to Sehar. Similar question to you. I guess the first specifically, and again, this has come from the audience, specifically around the state of emergency. So how can civil society respond to the effective imposition of states of emergency, especially when those states of emergency aren't necessarily announced and properly communicated? And then with that sort of same question to you, what is it that civil society can do, particularly in these highly securitized contexts and abominable circumstances that you're faced with? And maybe an adjunct to that is, you've got an international audience. How is it that international civil society can assist you in trying to push back on, these multiple drivers that are shaping the context that you're seeing? Thanks.
So the first part of the question was what activists on the ground can do. So what, in the context of Kashmir, we have been doing is, one, recording the issues that activists and organizations are faced with even in their humanitarian response, and then representing the same to government at various forums. Some of them have been heard, some of them haven't. So we've been trying to raise some of these issues internationally, as here on this forum. The other thing that organizations in Kashmir did very effectively, especially around the COVID-19 response, was to create their own coordination platform and basically divide up areas of operation for the COVID-19 response. Because they came together on those platforms, they kind of had a little more weight, with the government in negotiations. In some districts, the government did ask for civil society actors to come in and help in planning the response. So they had essentially a bit more freedom of movement and, some role in shaping the response and, shaping the severity of the restrictions. They could oppose that, and it also helped them to crowdsource a lot of money and to give it to the victims of the gunfights, to victims of other security incidents. So even local committees have been involved in this. So when I talked about the gunfight earlier, civil society helped them to the local community to organize a crowdsourcing platform where they were able to get the entire money to rebuild all the houses that were destroyed in a matter of 11 days, which is a huge achievement, I think. So what we can do, just to sum up, is to record, as Mutuma said, to record and represent. And what we'd like from our colleagues in the international community is to highlight these issues that we are facing, these restrictions, unreasonable restrictions, even with due permission, to highlight the media blackout, to highlight the highly securitized environment, this to say that this is not normal, because this cannot be the new normal. Otherwise, a lot of us will not be able to work in the future.
Thank you, Sehar. We're almost out of time, so we do need to finish a little bit early to allow people to get back to the plenary. But I want to finish with a couple of questions for Martin. The first was, is there some sort of creative tension between human rights and epidemiological approaches to addressing COVID? So human rights collective epidemiological approaches centered on the individual. If so, how might it be bridged? And then the second question, if you've got time to answer it, is, as UN Special Rapporteur, and I think as your current successor is doing, trying to find ways that civil society, which is under-resourced, compared to the scale of the sort of the problem that we face, to the extent that highly securitized responses are driving some of these downstream effects. Maybe you could also speak to the point about what civil society should be doing now. No small task, because I can only give you 3 minutes.
Thank you, Ben. I'll start with the easier one, the first one. I don't think it is a tension or conflict between the different disciplines. I think it's more a question of having human rights on both sides of the equation. And I think we, human rights people, we should admit that there is a strong human rights dimension also in what the epidemiologists say, or the public health experts say, and we should listen to that, and we should then say, but yes, all lives matter. Not only the lives you are trying to protect, but you must also look at the consequences for the health sector and what other deaths would result from what you are proposing. And I think there have been dramatic and drastic and tragic examples where countries protect their capacity of the intensive care of their hospitals, and then they don't count the deaths of elderly people who are not going to be transferred from nursing homes to hospitals. They are not a problem. They are not part of the equation. So what the human rights message is, count all lives, and then let's discuss. And it also means that one human right doesn't have absolute primacy in relation to others. Right to life has a prime place, but it doesn't mean that you can violate the absolute essential core of other rights. You must put all cards on the table, and I think epidemiologists and human rights people should be happy to discuss over the table of the evidence. What's the proven evidence for the measures you are proposing? What's the public health benefit? And then what's the cost for human rights? And everybody's human rights and all human rights matter in that equation. As to the second one, I think public discourse is the main role of civil society, and that relates also to the questions I got about states of emergency, that it's good to insist that Parliament cannot be suspended and Parliament must review emergency measures, whether they lapse or whether they may stay in place. But that parliamentary review must be surrounded by active civil society, which reviews the reviewers, reviews the review conducted by Parliament as to the constitutionality and human rights conformity of the measures.
Thank you, Martin. So we've only got a couple of minutes left, so I want to start by thanking all of the panelists. Thank you so much for joining us today and for your rich and valuable inputs and conversation. I also want to give a shout and a thanks to all the people behind the scenes who made this happen by making the Zoom work and doing all the technical stuff, feeding me questions, Fiona DeLondris, Katie Smith, Krupa Patel, Nicholas Miller on standby. And yeah, I'm not going to try to sum up everything we've heard. I think there are a few concluding remarks, that sort of things that have stuck with me that can be take homes for us all. The human rights response came too late after 9/11. We have an opportunity to devise and implement, more proportionate human rights protective frameworks. That proportionality, however, will only work if we can properly assess the evidence of what does work and the harms it causes. And if there's been one abject failure of the war on terror, I think it's probably in that arena. So again, there's an opportunity to learn lessons. I think the problems that we're all grappling with is this pivot of states to a highly securitized approach on the one hand, and then the pivot of security apparatuses and the private sector to COVID-19 on the other. And I think that is throwing up new challenges that as a community we perhaps haven't grappled with to such an extent. And then I think we've heard, tragically as it always is, that this exceptionalism is giving more power to the authorities in many parts of the world. The last 20 years has sort of normalized and paved the way for the acceptance of some of these measures. And we have a huge job on our hands as a community trying to push back against this. So my last job is to thank everyone once again and advise you that you are now to go post haste to the closing plenary, and that there is a link for you to do so in the chat. Thank you, Katie, for that, and thanks again everybody for joining us. Goodbye.
Thank you, Ben.
Thank you.
Thank you.